fun to be here. It's fun to be part of this group. I've been with this for many years, and I can't tell you how much it's meant to my profession, to work with you guys, learn from you guys. The relationships are incredible, and I've learned so much from you guys. So grateful for this opportunity to speak. I chose a topic that's a little different. I pitched an idea initially to John on the resilient spine. I had a case study in which I thought really showed that what someone with post-surgical, what they can do. You know, there's a lot of we can't run, we can't do these things, and it was fun. This case was a good example of all the fun things that we can do afterwards. But the more I thought about it, I thought there was more applicability in discussing kind of more of the foundational principles of the power of motion and exercise. And so hopefully this is more a broader topic that can hit all of us and have a good, rich discussion today. First, I'm going to channel Dr. Pitts here for a second, just do a quick history. I love history. The time I was preparing for this, reading the book on the Wright brothers, Orville and Wilbur, and their experience. Wilbur, when he was just getting started in high school, he was out playing, kind of a neighborhood hockey game, got hit in the mouth with a stick, and actually the guy that hit him was kind of the local bully, and he ended up going on to medical school, got addicted to cocaine, had 9 wives, 4 of them he killed, and he was the first serial killer in Ohio, so a great person. But this really changed Wilbur's life. He was on his route. He was on this route to go to Yale. He was going to be a lawyer. This happened, took out his teeth. He stayed home, tried to heal. Had heart palpitations. His mom got sick, eventually died. He felt he had to stay home. Had some digestive problems. Really, his whole life was altered by this injury, and kind of went into this depressive slump. And during that time, his dad, as a minister, had a library full of books, and he spent his time in that library reading books. And in fact, his brother Orville, just a few years younger than him, actually got sick at the same time, and he was up in his room convalescing also. So he would go up there and read books with them, and they'd read books on gliding and flight, the attempts of flight. And they would sit there and observe birds and watch how they fly, and they took copious notes and really developed a passion to learn how to fly. From there, they developed a printing press business. From there, they went on to make a bicycle business, repair business, and also developed their own bikes. Really developed the mechanical skills. But that moment of getting hit in the face and having that trajectory of life, going to Yale and everything being laid out in front of him was completely altered. And luckily for the world, he was able to pivot with his brother and really find incredible pathway going forward. I thought of that as just a powerful story. Obviously, the first in flight, here showing them in Kitty Hawk. Just how powerful that sometimes we run into people all day that have these amazing pivotal moments in their life. What are we doing to help them find a new pathway forward? And that's what I thought of as I prepared this presentation. What kind of can'ts and no longer? What do you hear on a daily basis when someone comes to your office, or you work with someone, or you run into someone? You don't even have to be a provider, but what do you hear? What do people say? I can't, because of my injury, I can't do this, or I no longer can do this. Just throw out some ideas. You don't have to raise your hand. Exercise is done. Good. Lift. Weights or lift. Yeah, what else? Lift kids. Golfing. Big. Gardening. Okay.
Simple things like even walking long distances, they can't get where they need to go anymore.
Yeah, for sure. No one said pickleball. I'm so disappointed. Yeah, we hear this all day. I can't get down on the ground and play with my grandkids anymore. I can't pickleball. There you go. I can't lift. I can't run. I can't exercise. I can't lift weights. Go do things with family. Those things are affected. Those are the things that we hear all day. Like the Wrights, I can't go to Yale anymore. My life is over. So much of what we do and who we are is derived from our ability to move. Performance matters to us as human beings. To be able to interact through the world through motion is so crucial to our life. And losing that is hard, and it has a significant effect upon your outlook in life. We have a tremendous ability to interface with people on those pivotal moments in their life, where they can either go one way and have a lifetime of can'ts, or we can help show that there is another way. And the future must include exercise and motion, one of the most powerful means to be able to move forward. growing up, my dad was a physical therapist, and he, one day, part of the work he did, he managed a hospital inpatient, and he was helping out in the inpatient. And this large man he was working with, trying to transfer, decided to just go down to the ground, and my dad was holding on to him and had a real severe herniation in his back. 2 weeks later, we're going on a trip to Disneyland, Disney World, and I remember, because I was, I think, about 16 or 17 at the time, I remember my dad just being in a bad mood the whole time, and you're like, Dad, what's wrong, And I mean, I know Disneyland can do that to you as a parent, but I remember everywhere we'd go, I'd say, we'd go get on a ride, I'm like, Dad, look, it says if you have back pain, you can't do it, and I, just being a little twerp like that. And for him, he took it to heart. Luckily, being a therapist, he said, okay, I had this injury, I'm going to turn this around. And every day, this is not the machine you use, there's what's called an iSelect, a real old exercise piece of equipment. It's just isometric hold. He would do this hold right here for 4 minutes while he read his scriptures. He'd do it up to 10 minutes a day. I mean, if I was going to bring one today just for fun, but if you hold that position, it's incredibly hard. His back became incredibly strong. He was able to go on and do whatever he wanted, and that injury did not, lay him with a whole bunch of cancer the rest of his life. Again, back to the rights, that was a change. So today I wanted to do kind of a more foundational discussion of the power of exercise and motion and what it can do. And as we talk and discuss this, as we get down, I wanted to almost develop a protocol with everyone here, and how that we can have better discussions with our patients, how we can encourage this through all aspects of our lives or an interface with people. This is a study that was done in the New York Times. This is from 2016, and this is the title, Closest Thing to a Wonder Drug, Try Exercise. And this, you may remember this article. I love this article. Just someone that went through and laid out all the studies and showed all the positive effects of just exercise. Super drug, right? If you think about it, everything that has come out recently concerning a lot of these neural diseases, other processes, continues to show this important aspect of exercise and how it can change those disease processes. I wanted to highlight just a few studies. This is one that looked at these wounds that were not healing. They were not healing long-term chronic wounds, and they took one group, no exercise or not much activity, another group that exercised routinely. Significant difference in healing times, and just from exercise. You're not doing anything different, just going out and walking, just a basic exercise. This is another one that looked at inflammation processes. They found that those who exercise, their immune systems are stronger. Immune systems being stronger are able to regulate better the inflammation process in the body. Inflammation process being better mitigated. You have all the good effects of that. Obviously, we know the effects of if inflammation is too high throughout our body on the cardiovascular, musculoskeletal system, all those systems. But strong immune system from exercise, better able to regulate inflammation. This one just more particular to spine, looking at those who just by walking and increasing the amount of walking, their chronic neck pain decreases. Again, no extra drugs, no extra specialized equipment needed. Going out and walking more, pain goes down or pain is mitigated. I love this quote. We have not effectively used the abilities science has already given us, and we have not made remotely adequate efforts to change that. We have this powerful tool, this super drug. How are we employing it? Are we employing it effectively in all our different means of working with patients? Wow, that was impressive. Physical therapists at our clinic, we have multiple practice settings. One practice that we do is cardiac rehab. Our therapist is Farah. American Heart Association has studies that came out and said those who do cardiac rehab add 5 years to their life. 5 years, that's quite a study just to be able to say that to an individual, say just by doing these exercises. Farah, she'll do HIIT exercises, high intensity training, with these 70-year-old, 80-year-old obese individuals and get them moving and get them stronger, and it extend their life by 5 years. They also showed that those who do cardiac rehab have a 41% decreased likelihood of another cardiac event, again, from that super drug, exercise and motion. This is Parkinson's. This is a program, it's called LVT Big. As we all know, Parkinson's, our amplitude of movement goes down. Shuffling gait, smaller motions, affects their speech, lose a lot of function in their life. One of the hallmarks, one of the most powerful ways to treat this is exercise, and it's called a big program. And Brian, one of our therapists, does this in our clinics, and you'll go in there and you know he's doing it because he's doing these huge, big motions and making them do it multiple times. And essentially you're trying to reset the brain through these motions to be able to let the brain, that neuroplasticity, to let it know that those big motions are actually helping reset your brain and to let you know what is real motion. And because they do these big motions, they're able to gain normal motions once again. Again, powerful treatment through exercise. ICU, we do the work here in the hospital. We'll have people on vents, and I've done this before. You think about someone that is on a ventilator, that is very, very sick, incredibly weak. Why would you want to get them up and move? And this is a respiratory therapist. This is, I assume, the physical therapist behind here. I've been on these where they'll be bagging them. We're wheeling around 4 different chest tubes that are draining fluids from their body. Very, very difficult, labor intensive. They do this, if they do just these simple motions, early motions in the ICU, mortality rate goes down significantly and their time and days in the ICU decrease significantly. Again, motion and exercise. More particular to spine, this is a review from 2021 in physical therapy, just showing that level of the A's and B's, and there's some C's I didn't put on, but just show level 1 and level 2 exercise, level 1A, level 2, just showing that exercise is one of the hallmarks of treating the spine and how it's, again, a powerful tool. All right, so that's a lot of the studies. So does that mean we go out and we're going to discuss extreme core? No, that's not what we're going to discuss today. This is what we do in our clinic, so isn't it? No, we don't. No. I like this. This is from a performance group that I follow, but they kind of break down performance. There's a triangle in all this that we have to work with, kind of the more foundational things: sleep, nutrition, stress, and recovery. Those things have to be handled first before you can focus on mobility, strength, speed, and power. Again, get that foundation, then you can work on the performance more. Whatever the performance may be. It may be lifting your kid, or maybe running a marathon, whatever it may be. But the crucial part is right here, and I think a lot of us run into our patients right here, this kind of bottom foundation where health is pretty poor. They've had an injury, they're not moving, and things are not going so well. The hard part is some people think, okay, I've got to jump up here. I need to go jump into a high intensity training exercise or whatever it may be. And so we skip too much. Instead, we got to stay down here. And so that's where I want to talk about. So this, kind of this area, and how movement and exercise and kind of the foundational principles there can and should be what we employ and educate our patients on a daily basis. So let's develop a protocol together. So this is where we get to talk and discuss. Basic questions: how many steps or minutes of exercise are most effective? And effective in terms of health, in terms of preventing injury or managing injury. Please share any thoughts concerning that. What do you counsel your patients in saying you should be walking this much on a daily basis?
I start with reminding them, first of all, they should go to physical therapy.
Good step.
But also, anything's better than nothing.
Yeah.
So if they're feeling like, well, I can't go out and go for a walk, great, go for across the room and then do that a few times a day. Just anything's better.
Yeah, you get over a lot of the barriers if there's not this, I have to go exercise, at the gym, and you get over a lot of those barriers are there. So.
I think it's dependent on the person, right? So it's an individual, we have to look at the person as an individual when they come in and see us or when we're working with them. I always tell my patients, I'm like, frequency and consistency. That's just what I want. I just want frequency and consistency. I don't care if it's getting up across the room and back, but at least do that maybe once an hour. But just be frequent and consistent about it. And that usually, I think if you sometimes put a minutes on them, they get stressed. Because they're like, well, what if I can't do that? Like, what if I can't get up and walk 5 minutes? Well, then walk 2 minutes. But just be frequent and consistent about it. And I think that kind of gives them a little bit of an idea that, like, okay, like you said, anything's better than nothing. So let's just work from there. And then we'll build up as you get stronger.
Okay, those are great. And obviously you're dealing with populations that are very sick. What about someone that is not quite as sick? Maybe that someone is just wondering how many steps, what kind of activities, what are some recommendations you guys kind of use as your standard?
I don't have a standard, but in Gawande's book, might have been better. At the very end, he says some off-the-cuff recommendations, and one of them is to count something. And the exercise of counting and keeping track of is powerful, because people who count steps, they will naturally, incrementally increase what they're doing. So encouraging some way of tracking or keeping count of is worthwhile.
Yeah, how easy is it today? I mean, some people don't even know their steps are being counted for them on their phone. I literally don't think they know that. And so, very true. I agree completely. Let me just throw up a couple studies that show kind of some basic foundational numbers to consider, and they should be counting, because I think that does help. This is one that looked at a lot of people, 365,000 participants, and this was a study in the UK. Correlational study, but it looked at those who are in the 18 to 2,400 minutes per week area will have significantly less likelihood of back pain throughout their life. So this has a preventative effect. And so if you want to say what will help me prevent to have back pain, 30 minutes of moderate exercise per day. Nothing crazy. Going out, brisk walk, riding a bike, whatever it may be, 30 minutes a day is a good way to kind of aim towards. What if they're having a spine surgery procedure? How active should a patient be? Does anyone have any studies or numbers that they've looked at? Or I don't want to spoil it, but this was a recent study here too. Looked at correlational data again, that those who, these are pretty profound. Each additional 1,000 steps per day at 6 weeks after spine surgery was associated with a 41% higher odds of achieving best outcome and 38% higher odds of no opioid use at 1 year. That's quite a good data set. It's correlational data again, so causation, you have to think, well, those people who are hurting more are not going to move more. But looking at these thresholds and thinking 3,500 steps per day within the first 6 weeks is a good way to look at this. What about before surgery? What if they're in pain and they're not able to move? What are some ideas on how you can help someone or encourage someone to move before surgery? Or should you, I guess is the other question.
I think you should, and we've talked about the concept of banking muscle. I really like the way you talked about the Wright brothers and the injury and this idea of pivoting and maybe even being a little bit creative with the goal of movement and being active. But it doesn't necessarily have to be the same way it was before. But maybe you go and get in a pool, or you do a stationary bike, or you find another way to stay active. But it should always be encouraging people to keep moving.
What if someone is legitimately in pain and they can't do? What are some options that we could help? How could we help them?
Just tell them to do upper body stuff.
Yeah.
I mean, just get them active. Find a position that they can usually be in. I mean, a lot of them know they're going to have surgery, not tomorrow. And so, encouraging them and explaining that what you just talked about. Saying, look, we don't expect you to start going out and lifting pianos right now before surgery, but how about find a position and I can't do anything like that, let's do our upper body. Just get them active a little bit and I found that they get more involved before they're ready for the surgery.
Yeah.
They're ready to come back and tell you right afterwards, like, okay, I'm doing great.
Mm-hmm.
That's very.
Data shows that too. Go ahead.
So, one of the things that we found with our research is that it's really interesting that we've been measuring motion with an actigraph, like just essentially accelerometer mounted on the waist, versus our sensors on the back where they're actually moving their spine, and realize that those are two actually very different times of the day. That just moving your spine, bending it, stretching it, twisting it, actually has value for your spine independently. Biomechanically, it's providing nutrition flow, support to all the soft tissues of your surrounding whatever level might be going to undergo surgery. The rest of it is all its support structure. So having that happening, even if it's just sitting in a chair and twisting and bending, is going to be far better than doing nothing. And so that discussion about kind of, like Eric was saying, the principles, right? Just the motion is moving and providing nutrition support and help, and biomechanically supporting all those tissues.
I'm going to step out of my presentation. I'll mess it up a little bit, but let me just tell you a brief story. My mother-in-law is 75. She's struggling a lot with health right now. A lifetime of just a lot of health challenges. And as I was preparing for this, presentation over the last couple of weeks, I was talking with my wife concerning it, and it's kind of dangerous, but she took everything I said and was parodying it to her family, because I said motion is so important. One question I think that we can ask our patients is, what are you preparing for? What are you training for? If they're doing less than 2,000 steps per day, what are they training for? What are they telling their body that they need to be able to accomplish? Death, right? I hate to say it. I mean, you're telling your body to lay down fatty tissue and the rigor mortis set in. I mean, and my mother, my great wife, took that and took right to her family and said, "Mom's going to die because she's not moving." All right. She said it. Go ahead, Brett.
Yeah, one thing that I was thinking about is, like, we talk about steps a lot, but sometimes steps is what actually puts them in pain.
Yeah.
Right? They think that actually walking is going to, exercise is good, right? But then it puts them in pain. But giving them variations of types of movement, just like Dr. Edwards was talking about, like, what do they love to do? That's going to motivate them, right? We know that they're going to get dopamine release if they move in some way. Maybe we could talk about activity pacing, and we break it down into segmental portions where maybe they're working for 5 minutes instead of 15, and they're building their capacity over time. And we teach about pain neuroscience and about that activity pacing and how that capacity can get bigger and bigger as they go more and more. We did a bed rest study in school. We put college students in bed for 7 days. We measured their intramuscular tissue in their thighs and their force output with dynamometry. And it was really interesting. These college students, some of them lost up to 50% of their strength in 7 days.
Nice.
And up to 7 pounds of muscle mass.
Yeah.
And these are young college students, right? So we know the detrimental effect of complete bed rest.
Mm-hmm.
Keep in mind, these people, we told them they could only use a bedside commode, so they couldn't walk, right? So that's complete bed rest. So it doesn't take a lot to maintain, but at the same time, we can all appreciate what can happen with complete bed rest. So teaching people just to move a little bit, whatever that is, it can be extremely helpful.
I'm glad a therapist said something. All day long we have people come to us, and I can't stand. All right, let's find another way. I mean, you're right. Walking may not always be, but let's look at other modes. Let's look getting in the pool, walking in the pool. It's great. Let's get on a recumbent bike. Let's get in a position where you can get your heart rate up and going, and still move, and not exacerbate the pain. And there's ways to do that. And that's a powerful thing. So. But again, ask that question: what are you training for? And I think it's a real good question to ask. Sorry, there you go. There's my coffin. So it was a good discussion with my in-laws. My wife, took all this and said, "Look, if my mother is not willing to move, she's preparing to die." And it was a pretty straightforward conversation because it needed to be. And thankfully, I think it stirred in some because it was interesting. They heard, well, she has slip disc. I'm like, does she really? I don't think she has a slip disc. And oh, she can't move. And I think we're okay. I think we can figure this out. So this is just showing the health app. How many have looked at the health app on your phone if you have an Apple phone? It's pretty instructive. It tells you your steps, it gives you your averages. You can't really hide behind these. This is not mine, don't worry. I'm moving a little bit more than that. So, but it tells a lot. Look at it yourself. I don't know how intrusive it is, but sometimes it may be okay to say, tell me how many steps you're doing a day. Let's pull it up and look at it on your phone. And the accountability is good. And if they're not looking at it, like Dr. Erdrich said, that just by looking at it, by managing it, they're going to have improved steps. Set some reasonable goals. I think that 3,500 step mark for someone that's in pain or someone that's either preparing for a procedure is a good number to think about. Getting up to that higher number, that 6,000 to 10,000, as they recover. Again, it has an ability to be able to have less opioid use. It has the analgesic effect, just their mood and everything else, all those positive good effects. We talked about this options that if someone is not moving. What about strength training versus aerobic conditioning? Again, this is that triangle I was talking about. Most our patients are living here, and we're working to move them up this triangle. The foundational principles of aerobic exercise have to be hit first. If you work on your aerobic exercise, you're increasing the mitochondria in their muscles. You give them basically better, bigger engines to be able to do some of these more difficult tasks. And so getting this foundation is kind of the most crucial part of where we can interface with our patients and encourage them to move. Does it work? Does just asking your patient to move more, to encourage them, to counsel them? This is a primary practice study, and it looked at how many patients they would have to see to have that clinical effect. And of the 12, they saw 12 adults. One of them would make the change enough in their life to be able to affect. And for this one, it was dealing with diabetes, to be able to affect their disease process. So it does matter. That's. You know what, you're looking and go, well, you speak to 12, only one will listen, but that's that one person, and that's actually a pretty good number. So 1 year later, they had that significant effect. So just by doing those counseling and recommendations. So just in summary, take your patients, counsel them, educate them, provide some of these foundational studies, move, exercise. It is powerful. If they can't move, work with a physical therapist, work with other medical providers to find ways to be able to move. We have that crucial moment in which they've had an injury, if they've had pain or even chronic pain, their life has changed and they're losing some of the things that matter to them. But we have that great opportunity to step in and create a new vision and pivot and show what they can do and how they can move forward. So, thank you very much.